Hello, Dinesh.
Yeah, hello, Dr. Sanjay.
हेलो हेलो। आज का सेशन YouTube पे भी लाइव स्ट्रीम हो रहा है।
Okay.
In case anybody has any problem, they can join on YouTube also. And later on, the recording will also be available on YouTube.
Just checking the slide. So visible?
Yes, it is visible.
Thank you.
रिपीट कैसे हो रहा है? So, friends, welcome to today's session. And today we have our very own Dr. Dinesh Badyal uh, from CMC Ludhiana. All of us know him very closely, but just for formality's sake, I request Dr. Monica Sharma, uh, professor in pediatrics at CMC Ludhiana, to introduce him. Over to you, Monica.
Thank you, Dr. Sanjay. You're right. It's a familiar name. I don't really need to introduce, but it's a formality. For those who still don't know Dr. Dinesh, I think it's an opportunity, it's an honor that I'm introducing my friend and mentor. Dr. Dinesh Badyal, as everybody knows, is a pharmacologist by training, but he's well known not just in the field of pharmacology, but also in the field of medical education. He's a CMCL Famer and Philadelphia Famer, the International Famer Fellow. He has done his MHP from UK, and he has also done an international PG diploma in bioethics and health laws. Currently, he is the Vice Principal Medical Education at Christian Medical College, Ludhiana. He is the program director of the CMCL Famer Regional Institute. He's the convener of the NMC Nodal Center at CMCL, and he's also the national convener of the Advanced Course in Medical Education. I'm sure everybody knows that Dr. Dinesh has significant contributions to the competency-based curriculum, both UG and PG. He's the member of the Reconciliation Board, and he's also the member of the expert group of the NMC's various committees. In medical education, his areas of interest are faculty training, simulation, student assessment, curriculum development, to name some few. He has written 3 books. He has contributed to several chapters. He has more than 150 papers to his credit. He is an international global faculty for various programs in medical education. And to name a few awards, I would say that some of the significant awards are being awarded the Fellowship of the Rector Institute of Clinical Skills and Simulation, Jefferson University, Philadelphia. He has been awarded several orations. Of them, most recent is the APJ Kalam Memorial Oration at KGMU Lucknow, the GHRE oration by the Indian Pharmacological Society, the Gani Satyanarayan oration at the AP Metcon, and the ML Gupta Award by the Association of Physiologists and Pharmacologists. I'm sure this is not complete. There is a lot more to speak about, Dinesh, but I think we should get on with today's session. Over to you, Dr. Dinesh.
Thank you, Dr. Monica, for the nice words. Dr. Sanjay, and I'm U India. So that I building for curricular update. I know we have been talking for a long time, and there have been many instances when we have collaborated. Many of the names I see right now in the participants, which I know have studied many capacity building programs as well as curriculum development too. So it's a honor for this oration that they thought of me, especially with the long association with the Dr. Rita, which is there. So our association goes back to some of the earlier days when we of any of the capacity building things. And when ma'am shared many of her thoughts that why we need capacity building. Right in the early stages in that medical education, ma'am was involved. She actually had a very good point of view at that time. And she always used to say, you people who are coming up later on, you must think about this thing, capacity building for the curricular updates in the right direction. So you can see some of our landmark publications, which most of us refer to in the capacity building. So changing concept of education with a mixed increased complexity of healthcare that has mandated curricular updates. And this actually has forced us to think about capacity development so that the educator, the present educator, can verify or sort of, you can say, authenticate their multiple roles: educator, researcher, leader, mentor. I know many of you actually wear that hat too. So basically, it enhancing skills and knowledge for the healthcare professionals. Now, why this is so? We do talk capacity building or development in general too, but here it is specific to curricular updates. So if you see all around you right now, medical undergraduate, postgraduates, MBBS, MD, dental courses, nursing, everywhere there are changes. Started in 2019 with the MBBS, then MD, further updates, nursing degree 22, and dental is now gearing up for another competency-based something. Nursing has already rolled out the competency-based curriculum. So it means in all the health professional educations, we are looking at capacity development or capacity building, which is reported to be aligned with the healthcare, improved healthcare. That's one of the important link. Otherwise, we have not thought about capacity development. People have been using the same techniques for teaching, learning, assessment for a very long time. So it has been shown that if you align curriculum with the local health needs, place learners in the community and medical clinical settings, teach basic healthcare workers, become involved in national policy development, and develop the field of medical education, and so and so. So this goes on, this link is very important because ultimately we are looking at improved healthcare in the community. The various terms, United Nations, one of the terms in the capacity development is the process whereby people, organization, and society as a whole unleash strength, create, adapt, and maintain capacity over time in order to achieve development results. Now you will wonder that how many words are there. It's unleash, then strengthen also, create also, sometimes we adapt also, sometimes we are done enough and we have to maintain that capacity over time. So ultimately we can show some impacts from development results. So they have used beautifully capacity development for various purposes. One of them is faculty development. So when I see capacity development in health professional education, one is major chunk is related to designing and planning, like curricular update, teaching learning methods, TLM, and assessment. But in parallel, you will also say, you might have experienced this implementation, that is planning organizational changes, okay, various schedules during the implementations. And if you look at both the things in parallel, designing and planning can be at the level of international. We have seen a lot of changes happening. Competency based is one component which is there in many countries now. National level, the changes happening in the curriculum, in assessment too. State level and university levels, where also they are developing further documents so that they can have a uniformity in implementation. So when we come to implementation on the other side, institutions or the schools are important part of that. Although there will be some overlap in both of them, that is bound to happen. So if I just replace those things, that was sort of a concept here, with the present some of the terms which you might have experienced and one is medical education units, and which conduct various workshops. You might have undergone or heard about that. And on the other hand, we have curriculum committees. We look at timetables, implementations, sometimes on the quality too. So in this way, these two capacities go in parallel. And maybe if you are thinking about in other health professional care education systems, you will think about that, okay, we need to think about designing planning at the curriculum level, teaching learning method and assessment level, but simultaneously we have to plan organizational schedules. Here also you might be developing some documents too. So let's get further some clarity on that and add some of the real concepts here. So in designing, planning, updates, teaching, learning, assessment, you will need a lot of faculty development programs, FDPs, which will relate to many of the things, like even concept development, new concept development, sometimes that comes up. newer ideas they develop, and you also disseminate that. And implementation, now you have to handle many people here. So it means you will be looking at team building, logistics, and program valuations. Who are the people involved here? So there are many people involved here, various stakeholders, institutes, faculty. Usually when we talk of capacity building, we think about the faculty. But remember here, a lot of stakeholders are involved: patients, regulators, government agencies, students, and use customers in this ladder, and the society, which we are looking at the major impact later on. I'm taking the liberty of using the example of MU India, where Dr. Sanjay has shown you how one capacity development, which started with an idea in faculty development, has taken shape. His project on CMCL framework, which was on electronic classroom for teaching undergraduate students. See, today you are sitting in electronic class for a capacity building sort of workshop, or you can say session. This is he dreamt of at that time. At that time, in that batch, you have like 12 people, then he involved around 150 people, and now it has grown to more than 25,000. Maybe number is more today. So looking at some of these things, for example, how he built up and how other people have built up a capacity development, when we look at the scope and the hope, there's a tangible and visible capacities, which we call as hard capacities. These are organizational structures, systems, policies you need to put in place. Okay, your curricula which are ready, and various procedures during that, which have been developed. And along with, you have a soft capacities. So hard capacity are tangible and visible, and sometimes it's easy to, to follow them, to see the outcome, like development of skill labs in various institutions. On the other hand, when we come to soft capacity, this is leaderships, values, commitment, accountability, and so many other things. Remember, that is actually now filling you that infrastructure with the people who actually show these qualities, soft capacities. So both of these things are at different levels in different capacity building ladders. You have to see what we are talking about. Sometimes you are involved in capacity building at international level, national level, or sometimes at institution level. Where all levels you can use these capacities. If you are aware of, you can very well place, okay, which one you are developing right now, where you stand as of now. We've got some examples that when we have capacity building during curricular update, what can happen? Some scope and some hope. Scope things are maybe where you can expand. Hope is futuristic things which we are looking at. So we are looking at teaching learning methods. We are looking at many of that, like self-directed learning, okay, which was something new for us at that time. DOAP, demonstrate, observe, assist, perform. The term which was introduced in 2019. Simulations, many people are using, but they are at variable level of expertise in this. Assessment, and in that, directly observe procedural skills. Objective structured clinical examination OSCE, meaning clinical evaluation exercise, mini CEX. So many of them people have started using, and some are hoping that they might use. This list is not limited to this. I'm putting up something which terms are already people are using in many healthcare professionals. Although I know many more have come, and you are also have a lot of that. And they are fitting into many of the new curricular updates like competency-based education, interdisciplinary learning, and the patient-centered approaches. Teaching learning methods. Some of that you will see that when we talk of teaching learning methods, we are looking at preparedness, skills, and technology required. Technology people have upgraded a lot when this curricular update came. Initially, we thought this will be a resource crunch because a lot of investment is needed for the skill lab. This is one example of developing those teaching learning method, which has happened over the, you can see over the last 4 to 5 years. space was an issue and existing institutions, newer ones also. Such a large space is needed. Many mannequins are needed, modules are needed. How to go about that? And a lot of money was involved. So initially people thought, okay, it might not function. It might come on a paper only. But curricular updates went in such a way that there was a lot of demand from the students. So if in one institution there's a good developed skill lab and student came to know, so they started comparing that. Remember, this is a process. Simple capacity development can happen when you are developing skill labs, but here was a lot aligned with the curricular updates, which everyone was aware of. And fortunately, we made students very well aware of that during their initial training. For example, in medical, there's foundation course. I know in other sciences also, they make them aware about the entire course. So they were very well aware that what a medical college should have. So these curricular updates in all the stakeholders led to sort of, you can say, reverse pressure so that there was a capacity development. Okay, so here we are talking about hard capacities also, which is infrastructure, because many of us, including administrators who were facilitator, teacher, faculties, we were also struggling at that time. What are the hard capacities in the skill development? We never thought about soft capacity also in the skill development for a long time. Okay, first you can see here also as it started hard capacities, slowly and slowly soft capacity, which people are still picking up. So there will be a lot of variation you will see in capacity development in one example of skill labs which are there. Similarly, you will see these variations are prevalent in many places, in many other teaching learning methods. So although we know these days you get highly sophisticated prices coming down, this is also helping capacity developing. Another example is sometimes, for example, I know few of you are and nationwide, and not on paper. And you might have seen that many places this has happened actually. So capacity building, the stakeholders you see, which are many, related to many things. As I said, we just had these terms, OSPs, simulations. They're more like SGD, small group discussions. More are getting added now. Okay, so you in the capacity development, as we talk to many people, stakeholders, talk of less of group things and more of small group components. Blueprinting becoming the norm everywhere now. People do ask for blueprinting when you ask to design assessment. People are integrating, competency terms coming everywhere. Feedback, earlier it is there for a long time in the capacity development also, we are training many people, but the actuals of utility and application is happening now with the curricular updates, because it has become a central theme for all the components. Whether you talk about OSP, logbook, SDL, feedback will come everywhere. So it is something which has to be the center stage of that. However, when we talk of capacity building, remember that we should not forget about the younger minds, our students. Student here, I'm talking about those you are teaching and who are just you can say who are just started on the ladder of medical education as facilitators also. So your JRs, junior resident tutors, you also mark them tutors also. But remember, they are young minds which are sort of student facilitated for a teacher. So that is something where you have to be very careful, that transition, because sometimes they have a sort of fixed assumptions about the capacity development, how people, we see various stakeholders at a fixed ideas. So we need to break that and somehow inculcate these habits right in the beginning. You might find younger minds easier to handle. Then you have a faculty who are well experienced. I know many of you have joined today. So what happens when we talk about involving evolving minds? Sometimes you face a lot of resistance. one of the biggest challenges during curricular update in the capacity development was faculty resistance. Everyone was saying, you involve the junior faculty, they will say, you need to get your senior faculty, only then we can take the curricular updates in the forward direction. And when you take the senior faculty, they will say, okay, it's a junior faculty who need to work into this curricular updates. Till there was some sort of bargaining in the process which happened, which everyone actually allowed to happen. People, a lot of mentors are here today, and we know how this happened. This whole process, which was slightly not, I will say, very slow, it happens very fast actually, because the batch came, COVID came, a lot of new things came, and a lot of people started going to interprofessional health courses also. So we were all involved. And so much of help was needed that we have all the healthcare professionals involved in most of the curricular updates across the professions too. So faculty in the integration, we talk about various components in the teaching learning assessment. This was needed. This challenge was there. It has sorted to some extent with a lot of activities which is happening across the subjects, across the professions. And this has right now helped a lot. In the last faculty development program, this month only, in one of the faculty development program, we had 7 principals out of 30. You can say the stakeholders which are at higher level in the ladder, and their feedback was excellent. And when they say it's very important for them to come to a platform where other people can challenge them, and so they are then forced to think about the strategies. Otherwise, if they just do in their institution, it is very difficult that they will be challenged for those discussion points. And when the junior faculty saw principal level people are getting so much into these capacity building, there was a lot of gelling together. I saw a lot of collaborations happening there on that day, networkings happening on that day. Although initially there was a lot of resistance. So this whole thing you see in last 10 years or so, different training programs, different names of these training programs, different documents which are coming at various stages. Remember, it is an capacity development. Good example of a capacity development during the curricular updates. Without curricular update, it might have been not so easy, but I think both pushed each other. So that was of help, you can say, this process had from each component. You be wondering till now, we are putting so much of stress due to the curricular updates on various stakeholders. One of them is faculty. We are asking them, okay, have you done this one? Okay, then you are allowed to go further, otherwise not. Okay, even then again, somebody will ask, have you done this? Oh, no, you want to become, you need to do this. And sometimes they are not even sure about terms which are happening, evolving very frequently. So I think in this evolving curricular updates, there's a lot of pressure on the faculty too, and other stakeholders too, which are looking at these things. But basically, what is happening in all the capacity development, we are following the same basic learning spiral, where you have a new experience and you sort of register that experience, analyze that, reflect onto that, and take action based on that, and keeps on expanding. So this is sort of what is happening. Most of us has experience in the competency-based education, which is a major curricular update. Right now, we are in the middle of that. Our experience with some of the short term when I say, these programs has told us that although on day one, capacity development, when we tell people about curricular, it's very challenging. And short-term program, we can just make them aware about these things. What is capacity development and how it is applicable to curricular updates. All people who are attending these short programs might not be so intuitive, or you can say curious, so that they will take up further training in the further components of capacity building. But you will find these days, there is slight reversal now. Many of them are interested. And earlier, threatening picture where you have seen faculties being asked about various courses. Some percentage still comes, which they are looking at certificate. They are very, for example, they have very fixed idea on day one. And by 1.5 day, our experience says they start changing inside. They think about, okay, this has changed. Lot of components have changed, especially in the short-term experience to involve some of the students. This is important. When they see end use customers talking about those things which are happening around us, then there's a major impact on that. Let them share, ask them questions, share their actual experiences from the student side. Our long-term experiences tell us that definitely there's a lot of demand now. Earlier, we got a bunch of people who were very interested, but they were limited. And we were seeing that number of them were getting trained multiple times in different courses. But now there's so much of demand that we have to segregate them so that everyone gets a chance to go into long-term programs. Long-term, we are talking about 6 months to 2 years. Many programs are available now based on the time investment you can do, your need, and your position in the organizational structure. You can think about which one suits the best. But these are availabilities are there. So when we talk about this program, whether these are short-term or long-term, there are many studies have been done on capacity development indicators. I'm just quoting one of the studies. For example, they have developed some 26 indicators under 5 headings: development and innovations in teaching and learning process, development and innovation, communication and collaboration at different levels, and sustaining programs. Sustaining is something which we are not looking at. We have started a long time way at various places throughout the country. Now we have to sustain programs. Development of educational leadership and management. So because of sustaining faculty development programs, we have a lot of leaders, and you can say people have reached that level. We are looking at the management part. And development is scholarship. So many publications we see these days coming into the curricular updates from India. There are a lot right now, the literature which is being produced. So that is a evidence indicator here about the capacity development which is happening in curricular updates. You might remember some time back when these curricular updates were not there. There were few studies happening on this side, capacity development, but it was not easy to publish. But right now, every journal, every places, books are coming up, other things, methods are getting published. So there's a lot of demand also, and every journal is giving a special attention to capacity building with the curricular updates, specialty journals too. So we were just having this discussion on master adaptive learner in one of the earlier annual conferences, and which tells us, okay, that these learners which we are talking about at UG level, PG level physicians, remember at UG level also, these people are at capacity development. When we talk of health professional education, PG level, that increases more, and then the physician level. So identification of gap between medical literature and practice of medicine, which needs many components. So sometimes this becomes their routine expertise when they identify deficiency and target to correct them. In the adaptive expertise development, there's incorporation of creative ideas and novel solutions in rapidly evolving healthcare. No, this is, you might be wondering why we are putting this today, because this is becoming very important. A lot of people say, okay, now new curriculum has come, when the next curriculum will come, why there are a lot of changes keep on happening in the curriculum. Last curriculum was there for 22 years. I'm taking example of medical. Even you look at dental curriculum in the BDS, last was 2007. So long time has passed by that. But now when the changes come, and there are a lot of other changes come along with that and continuously. So I tell them, please don't expect now there will be a fixed sort of curriculum. Curriculum will be evolving. So we need to plan, learn, adjust, and accordingly assess the learning and receiving feedback will go. So these 4 phases of master adaptive learners are really becoming a reality now in many of the courses. Earlier we thought, okay, new technique has come, but Now, so many changes happening in the curriculum here and there. So many updates are having. You people also providing a lot of feedback. This is of that also. So it is going into that direction. This you might have seen many times. It's the medical curriculum, the major changes which has happened, the 5 roles which have come, and the new components like foundation course. I told you students are very well aware of what is inside now in the MBBS course. Early clinical exposure in the first year, integration, skill labs, electives, which one batch has experienced right now. Lot of capacity development is going in the electives right now. We found lot was needed to train people how to act as a guide or sort of preceptors in the electives from the teacher side. Self-directed learning has settled a lot now. Community-oriented education is still coming up. We need to align many of our components to that. Assessment changing to formative. Lot of efforts are going on, but still for this to happen, a lot of time investment is needed. So looking at this whole scenario change which is happening and the curricular updates which has happened, where people now we are keeping competency in the center, lot of things which you see out of this red box, like learning objectives, teaching and assessment. There's a lot of flexibility to us to experiment, do more capacity development as per these curricular updates, devise new methods. Even assessment, you try and see what better. So as I was telling you, curricular updates forces us to go back to newer competency development. So in the framework which is in India from 2005, now a new course has been added, framework competency-based education or FACE. It is now, if you look at in the second to third year right now, international and regional phase. So the need generated by the curricular update led to that this is needed, because the courses which right now available, we see the number of applications is 4 to 5 times in each course, all the other courses which are available. Hence, there was a need for that. And because of these, you also see a lot of curriculum documents, national guidelines, state university documents, individual groups are working on documents are coming up, which are actually adding to our knowledge base and also helping us in the capacity development. A lot of people, we ask each other, can we use some of the methodology as well? So people are now disseminating, sharing all those components. Going beyond those things, where we have a lot of debates also, like sometimes micro teaching, document designing. This we think still people need a lot of capacity development because it takes a lot of time. We say it's very difficult, easy to formulate, for example, sample paper, blueprinting, university guidelines. But if you get into that, it takes so much of time. The first document draft will come, so much of revision will happen, and third keeps on. It takes months and months sometimes. And you will wonder it is small sample paper only, a blueprinting only. And the quality evaluation, how to integrate that into capacity building. You keep on training people, but how to monitor that? Okay, what is happening after that? Follow up with that. These are some areas which are coming up, and we hope that more will come into capacity development even that, because curricular updates do need us to add these new things, all these capacities which we need in that direction. Faculty development, when you look at the national level, we have more than 700 medical colleges. Graduate number has now increased more than 1 lakh, 96,000 faculties. Is a huge capacity development at national level. If you look at, this was properly aligned with the curricular updates. So this is one of the best example you will see how the capacity development goes hand in hand with the curricular updates. So you will see this information available on the National Medical Commission's website, which they tell you about number of people who have been trained. Right now, with the basic course, which is there 3 days, the number is more than 80,000. Curriculum implementation support program, 30,000 was there with the year 2 when we did it. Now it has started SIS 3 version, so it has gone up now. FAMA trained in India around more than 1,000, with different avenues which are available. if we are talking about capacity development, it means we should have some venues where we can think about approach to values, think about where I can fit into that. As a faculty, you think about, as a other stakeholder, you think about, or you are an administrator, you want to go into all these nitty-gritties of the curricular updates. So you can now decide about that. 3-day programs are available. 1 year advanced course, which was earlier there. Some part is still going on. So we are right now a mix of that. And newer one is 6 months, 2-year FAMER fellowship, 1 year phase course, the new FAMER course, 2-day curriculum implementation board, which was earlier 3 days, master's program, masters in health professional education. Some Indian universities are giving that. Subject specialty societies, so they are doing competency-based education programs, college level programs by the medical education unit, and societies are doing a lot of programs, and even FAMER groups, many FAMER groups in India and other countries are also doing capacity building. So there are many avenues which are available, and looking at the change management, which we have seen, and a lot of studies you will find on change resettlement in research in medicine, looking at the role of the change agent in the health and education. If we are take example from the medical, 60% people said that personal position of the change leader is important. So you need to match the needs for a change to the values and needs of the people you are asking to change. This is a very important statement which we have seen. This works very well if you match it. Otherwise, what happens? Some people come for your training, capacity building. They are lost at the end also. They will feel why they have come, they have wasted so much of time and other resources. So effective change management, if you want in the capacity building, you can remember that capacity building you are trying to multiply. It is not possible if you are involved in one capacity development. It is not possible that your group can train many people. So you have to see at other factors also. And some of the most frequently cited factors in effective change management, which you will look at some of the people you have trained who will go out and multiply this through consultation, talking to people to explain the change. This is helping a lot. We tell people talk and talk and talk. They ask us what will be the next strategy. We say talk and talk. They say any other strategy. We say talk and talk. Teamwork, ensuring the need for change is agreed upon. This is important. Ownership of the change. Let everyone who is involved into that have ownership of that. Use of demonstration projects, which is helping a lot. Many of these long-term capacity buildings have a project-based learning. And then trains of time are there, which you have to match. That's why you have to, you can say, customize these programs these days or tailor to the needs. And coming back to same diagram, lot of pressure on the stakeholders. They need some motivation. Remember, it's very difficult to tell, okay, certificates are needed, you come. But fortunately, we are getting many people who are motivated now. So motivation has been helped. I've seen there are real examples of that now. They are getting incentives, recognitions at all levels, international level, institutions, state, university. This is helping them in the promotions also, career development in a certain specialty in the health professional education. So implementation science, which is working on the human behavior, stakeholder engagement, implementation strategies, evaluating and sustaining the components, all you need to build up together into that. That's how some of the motivational strategies you can incorporate into this component. You need to assess your stakeholders. This diagram you might have used in many of your programs. So remember key influencers who are there, engage and consult. One of the component I wanted to share with the faculty development program, capacity development, which we have seen in other subject specialties, having a lot of capacity development happening in the evenings at the group classes. First time we had a capacity development in health professional courses in the evening with the dinner. So that change. But people who were initially very reluctant, but I think this worked very well. So here we are talking about tailoring our capacity building to the curricular upgrade needs, where people wanted not to come in the daytime, evening time was okay. So something like that. So this change cycle, which is there, you might have experienced, you yourself might have gone, we have gone, all of us have gone through that. And now people are different stages. And mentoring does play a lot of role. And remember that curricular document, national, state, university, individual documents which are coming out at many places are helping in this capacity development. So in a way, this whole effort of capacity development, which has shown a lot of scope, and also there's a lot of hope that because we need many more documents. In spite of reinventing the wheel, we should be using methodologies which are well developed and tested in various institutions in the India, so that it will help us a lot to save investment of time and resources, sharing, disseminating all those modules. Today, you think about capacity development, somebody has developed a method, and even a single small method in one institution. Look at the number of institutions, just medically 700. We can have so many methods sharing, but sharing is important. I wanted to share important example of one component. Earlier, I shared one more. So this is something with the MCQ, which everyone needed. After the introduction of scenario-based MCQs, everyone was looking up, but still there were a lot of questionable MCQs coming up. Remember how the students react to the MCQs when you get papers, how the teachers were reacting to that. Okay, whether this will improve or further deteriorate the education. So faculty development program is that. Lot of document preparations, university policy preparation, actual assessment. So lot of documents workshops were done, which led to many papers. Okay, this is maybe 1 year back, then this is recent one, and this is converting into lot of actual documents people are using in assessment. University sample papers. A lot of people got trained. Then they went to their institutions and they trained it, multiplied the same workshop, which is happening. We tell them, please go with your ME, you develop more of the components, do the same workshops. Simple things sometimes are very, very effective. So in the capacity development, when this curricular update was there for the MCQs, we know this was needed everywhere. So you can also identify some of the areas in the curricular update and see where capacity development is more, and start at your level, whatever you can do, institution level, state level, university level, based on your position. Assessment has a lot of components. We won't be able to go through all, but there's more emphasis on formative and structured feedback. So it means we need a lot of capacity development here. People do say, I know how to give a feedback. When it comes to structuring that throughout the year for a single batch, it becomes a challenge. So we need to train multiple hands here so that it becomes feasible too. So just look at the internal assessment. It's not easy. Okay, there's so much intricacies. People say, okay, we do assessment. Do you have proper records? Everything. Are your students happy? Are you able to defend what you are showing them at the end of the year? Are you really know your internal assessment is correlating with your formative assessment? So these are the things to be seen. For example, this new component of reflections. I know many people, all of us actually struggled initially with the reflections. Even some, we know from student side also, there was a lot of copy paste which was going on here and there. But people are settling down now, giving a proper time for writing the reflections. They have understood why it is there. And some of them also reading them well now. And talking to the students about that. So going to electronic format of portfolios and other things is also important these days. So remember, this is something which is helpful when you have things like this, which are documented well, which you have been involved into that. So this way, this can help a lot. That all these assessment records, designing documents, assessment is a big challenge. You have to make all these documents, capacity development at the state level, university level, college level. So this is a lot here to do. Direct observations, we say we have to do a number of times for these competencies. Because in all the curricula, in all the health professional, we are looking at competencies. It means we are certifying them to be competent. How to do that? Again, we need a lot of capacity. So what I see in the future, in the scope is, and some of the hope that we are all going into, virtual reality, augmented reality is already there. Even I know many of the people who take sessions like this, many of people use chat GPT, other things, artificial intelligence to build up a lot of things. In platforms, today you are sort of in a platform, digital platform like that. Simulation-based trainings are expanding in many directions. Remember, simulation doesn't mean only skill lab, it goes beyond that. So we have a lot of hope keeping in those components. So to sum up, Building capacity in education is essential to ensure that healthcare professionals are well equipped with the knowledge and skills needed to meet the evolving demands of the healthcare landscape in the country. So, as very famous quote by Dr. APJ Kalam, dream transforms into thoughts, and thoughts result in action. So this is what happens exactly in the capacity development and the curricular updates. Some we have seen, some are going on, and some we hope will be successful in the coming years. These are the references which I have used. Some I have put in between also, some are here. Thank you so much.
Thank you, Dinesh. You asked me how long should I speak, and I said, I just casually said 45 minutes, and you exactly finished at 45 minutes. So I could have said 60 minutes because this, I mean, the amount of data you have brought in is just enormous. So, I mean, it was really a great lecture, and thank you very much on behalf of MAU India and all the participants. And now we share the Rita Sood Memorial Oration to you.
Okay, thank you. Thank you so much, Dr. Sanjay.
We are not giving the Lifetime Achievement Award this time because we know there is still a very long innings is still there. So that we will give you after many, many years when the output is, we know it is going to be enormous when we give you another oration, and then we will come up with the Lifetime Achievement Award. Thank you, friends. The recording of this will be available on YouTube. Many of you have joined on YouTube Live also. So thank you to all of you. And with this, we end today's session. On the YouTube,
Thank you everyone
can post your comments also. Thank you, Dinesh.
Thank you, sir.
Thank you so much for the most wonderful session, sir.
Thank you. Thank you.